The recording is in progress.
All right.
Greetings to everyone in the house.
Yeah. Greetings, Ambassador Folorunshola from Lagos. We can hear you loud and clear. It's a pleasure.
Okay. Thank you. Thank you for having me on today's Zoom. May God bless you all.
Thank you.
My name is Ambassador Folorunshola. With me here tonight, I have humanitarian Josephine Ikudengu. I'm also expecting Dr. Remy Olusimo, the United
He's already
States.
here.
It's already here.
He's already here with us.
States, okay. I'm also expecting Dr. Ogechi Abazi.
She's here with us too.
Humanitarian James. I'm also expecting her.
All right. Are those your members of your organization?
Yes, they are all my members.
Please tell us your name. Tell us your name and the name of your organization.
My name is Ambassador Folorunshola. The name of my organization is Mercy of God for the Age Foundation. This organization was Mercy of God for the Age Foundation. I'm a retired nurse, a member of Nigerian Association of Social Workers, also a member of COSCOPIN, Coalition of Rights of Older Persons in Nigeria. Our organization was established in 2010 in the month of October. The organization was established in October 2010, and we have been doing monthly programs for the older persons since that time till date. Are we together?
Yes, we hear you.
I should continue. Hello?
Yes, please continue. And in the chat, if you put the name of your organization and your website and a way for us to contact you, that would be helpful too, if you're near a computer.
You're not loud enough. I can't get you, please.
You can continue with what you are saying. And if someone can help you to put on the chat the name of your organization and the website.
Yes.
Continue.
The name of my organization, once again, is Mercy of God for the Age Foundation. The website, www.mogafoundation.com. Sorry. Our focus is for the old people, 60 years and above. Our goal is to see that the elders live a blissful life within all the elders within our community. I was the local government when I was a nurse 11 years ago. I moved from that local government to another local government, Ifakojaye, so Ajeromi Ifelodu local government. I established it there. I moved to Igondo, Ikosun LGA, local government. I established it there. I moved on. I also established all to capture the elders within that community so that they can live a better life. Our goal is to reduce their major challenges and to improve their well-being. So we have been doing this, and the services we render are majorly medical, holistic medical care. We render charitable services. We render charitable services in which we give them food items to improve their nutritional status. We give clothing materials to improve their standard of living. We give them various health education, and we let them know the various changes that occur during aging process. That life is in stages, and we move from one stage to the other. We let them understand so that it will not meet them unaware. We visit other NGOs, other partners. We celebrate yearly World Elders Day. I am saying, they are all evidence-based. We make them happy as much as we can. But while doing all this, the major challenges we are having, we encounter while we are doing this is because the extension is large. It's a bit large. Now that we are even retired, the situation is tougher. But we are looking at assistance. If we can get assistance, we can do better. We are looking at space. We are looking at space where we can have capital projects, like having old people's home, where we can give them better care. Because out there, even right now, we still have some cases of homelessness. We at times, when we get some of them that their situation is so bad, we provide accommodation. We come together, we provide accommodation. Some we give cash gifts. All I am saying are evidence-based. I have everything to prove. So in the accommodation of the old people's home, we propose to have a mini clinic. We propose to have mini clinic and a recreation center, as well as a farming, little farming, where we can have everything within the same environment, so that we now get health workers, nurses, doctors, or caregivers in place, so that we can serve these people better. Because we can see in society today that these elderly, they are highly neglected in the society. They are not being cared for, not even stipend for them. So we want them to live a peaceful life. And that is why we are putting effort so that the government will see what we are doing, and one day they will come to our aid, and even themselves, they will be involved in the care. Thank you.
Thank you so much, Ambassador Lawal. We can hear you. Thank you so much. Well said. And this program is an interactive one. I know you are just meeting Ambassador George Andres for the first time. He's going to be the one to ask questions and evaluate you and what you do because of other programs they have for you over there. So now I will want Ambassador George Andres to introduce himself and to go ahead with the evaluation or whatever questions he might want to ask you and other members of the foundation. So you are welcome, Ambassador George Andres. Please, it's over to you, please.
Yeah, thank you so much for time with you guys today. My name is George Andreas, and I heard all what Mrs. Flora, I guess that's the name. Mrs. Flora, is that your name, right? Hello? Can you hear me?
Hello, sir. I can't hear you well, sir.
Okay, I'm saying that your name is Flora, right?
My
Okay,
name is
Mrs.
Flora.
Lawal. Mrs. Lawal. Okay, Mrs. Lawal. Okay. Thank you so much, Madam, for all you have shared with us today. I am so excited that we have someone that is passionate and for the past 10 years have even seen before the government of Nigeria to see the need of integrating an inclusive policy for older persons in your community.
Thank you very much, sir.
I want to appreciate you because it's a very difficult job. I am also into aging. But before I continue saying this, after thanking you and appreciating your effort, my name is Ambassador Dr. George Andreas. I am currently the International Executive Director of Geriatric Care and Vulnerable Support Initiative, which is a UN accredited nonprofit with special consultative status to the United Nations and with a 501c3 federal tax exemption in the US, Canada, and we've been operating in Nigeria for the past 6 years. I am the for the rights of older persons in Nigeria, COSROPI, and I am a member of the National Strategic Advocacy Group for the Global Alliance for the Rights of Older People. And I'm also a strategic and a member of the Committee Against Ageism with CAN-Age, which is Canadian forefront right-oriented organization that protects the rights of older persons in Canada. So I belong to the African Palliative Care Association. I'm a member of the stakeholders group on Aging Africa in New York, and a member of the Geriatric Association of Nigeria and the Gerontology Society of Nigeria. Moving forward, let me cut off my protocol and continue with why we are here. I had a discussion with Mr. James, Ambassador James, who is doing I'm so happy. I will talk to him later. The kind of work he's doing today, connecting people of like minds, having to spend this time to host a very high structured meeting of this caliber. Very, very I'm so excited at the level of professionalism I'm seeing here today. Unlike the way Zoom meeting always frustrates people in Nigeria, this is very, very stable. And I think I'm going to buy into this method after this. So, Mr. James, I want to thank you for this, for converging us together. So, Madam Lawa, I requested to have an audience with you, probably with some of my board members and members of advisory council, which I'm still finding out if some of them have attended the meeting or they are still to join. So today, our topic today is for me to understand your organization, your policy drive, the structure of the organization, the level of engagement, your community involvement, your model operandi, and can you hear me? I can't hear you.
Yes, we can hear you. Dr. Remy speaking. We can hear you.
Okay. So I think she can't hear me. She's trying to say something on the background. Can you check on her, please?
Most likely she's having network challenge.
Can you unmute her?
She has to unmute herself. She has to unmute herself.
Then tell
Ambassador
her
Lawa, please unmute yourself. Unmute yourself whenever you want to say something. Just unmute yourself.
Okay.
All right. Can you hear him?
Yes, yes, that's him.
All right. He can hear you.
Okay. So today, Ambassador Lawa, why I'm here, what we are here is to hear from you all the good works you've been doing, your policy drive, what is the structure of the organization, what is the coverage of the organization in Lagos State, what are the recognition you have on ground, and what are community engagements you have that will affirm the fact that you have actually been doing this work, and what are the various government involvement in what you're doing, even if they are not funding you. Government is the sole authority of every person in any country. So whatever we do, we make sure that we get affiliated to government. So I will repeat myself again. The thing we want to know is the structure of the organization. I want you to put it down if I was so fast. You put the policy drive of the organization. What are the policies you're pursuing? What are your community engagement? What are the evidence-based connection you have with the communities where you're working? What are the resources you have available with you? And what are the procedures? How do you render services? We want to know how you actually touch people's life. We want to know what are the methods that you translate your policy into implementable actions. So we want to know how you do it. Then we also want, when we hear this from you, then we will know how we can partner together. Before I continue, I think I've heard of you before. That's to encourage you. Mrs. Victoria Ono, the Secretary of Gosopi, sometimes told me about one woman who has been doing so much work in Lagos State that has covered about 3 to 4 local governments, a retired nurse. I didn't know that there will be a day I'm going to meet you from another person. You know, she told me about you and told me that she's always there to support you. And so there was a time I told her that why can't you bring this woman into full-time cost swapping and see how cost swapping can give this woman assistance to actually do the job. And you and I know the way cost swapping is running. Cost swapping is being run by somebody from somebody's pocket. It's not easy. So I thank God we are here today to discuss this and to make a way forward. So, Madam, can you tell us what is the structure of the organization? Let's start from there. You can unmute yourself.
Hello, sir.
Yeah, I want to know the structure of the organization. The structure. Or if you don't understand what it means, I can explain.
Please do, sir.
Okay. Feel free, don't be tense. I'm seeing some kind of tense attitude coming up. Don't be tense, right? Please be very, very free. Don't mind the way I came with big language. I just want to be formal. But the truth is, be yourself. You are doing a good job.
Okay,
You are a wonderful woman. And we appreciate you already. So what we just need is, when we say structure, what is the constitute of the organization? What is your organization's core value? What do you believe in? And what prompted it to come on board? How is it constituted? Is it a foundation? Is it an NGO, a boot on ground organization? Or is it a community resource center? Or how do you go about your project? How do you come up? What's the structure? Who are involved? Are you the only one? Or do you have board of directors? Do you have people that oversee you, that ask you questions how you run your system? Are you answerable to somebody? Is somebody also demanding questions from you? Do you have financial records? How do you do your bookkeeping? How do you manage your finance? Is it your business or is it our business? Do I make myself clear?
Yes.
Yeah, so this
What's I'm coming?
Mr. James, I think you want to come in.
What?
Let her talk. And she has some other board members on board now. They can equally assist her.
Yeah, but I want to hear from her first before let her answer.
Right,
I've been breaking it down gradually for her. So
gradually, yes, I got that.
This is a very big problem about NGOs in Nigeria, and this is what we are solving. By the time we work with you, your system will change. You will see the way you are producing results that can be quantifiable. Somebody can measure what you're doing, not by pictures, not by videos, but by what? By data, in the form of data, live data and raw data, which is what the United Nations is looking for, which is what you use to measure the ability of any organization. So I want you to tell me, for the start, tell me the structure of the organization. Is it a foundation? Is it a community-based association? Is it an old people countryside association? Is it an NGO boot on ground? What kind of system are you running, Madam Lawa?
Yes, I am running a foundation.
Okay, a foundation.
And we have board of directors.
How many of them?
There are 7 in number.
Okay.
There are 7 in number. We are registered with CAC in the year 2012.
Okay.
And we have our registration number. Although, since we registered and we are running this organization, we have not gotten any grant or assistance from the government. We have been running it on individual support.
Okay.
So we have not gotten any grant, but we are registered and well structured.
Okay, that's fine. I got this. So when you talk of individual support, so how have you been managing your the organization? Have you been having meetings? What is the method? I want you to tell me. What is the structure of your meeting? Do you have meetings for your foundation?
We have our meeting on quarterly basis. During the time of COVID-19, we had online meetings. All our members were online, like we are doing this Zoom now. We have our records, we take our minutes. We even register in the local government. Apart from the CAC, we register in the local government of our operation, and we have our certificate. So we have been having meetings on quarterly.
How many local governments are you registered?
I am registered in one where I am doing the operation, because what I did is what I am doing. I try to start in a local government. When I establish it in a local government and it's taken by the government, I will leave it for them, because my goal is for them to know that it is their right to take care of the old people. I leave it there. Since I have my own, I know I have my own, and since I'm still a civil servant, I move to another one. The new one I go to, anyone I get to again, I establish it again. And when I establish it, I leave it there. But I will continue the monitoring. I'll be monitoring it. Then I move to another one. When they put me again to another one, I will establish it there again. So when we are about to have World Elders Day on yearly basis, I pull all of them together. We now celebrate. We celebrate them together. But some of the local governments, I don't want them to, some of them to come over. I will now go and meet them. Like Amu Wadofin, for example. Amu Wadofin was the local government I retired. So I established it there. It is sound and well structured there. So when the chairman was saying, he does not think he can allow, okay, I said, okay, I will come. I went. We did it, and it was, I have my record. The AHIABGA people, the AHIABGA fellow, the local government people, they have been trying to manage the elders, because that one is well established. But when I left, and the chairman that was supporting me left, the thing dropped. But when it dropped, what I did was that I looked for somebody that was living at Amu Wadofin, that we are working together. I made her to go to AHIABGA fellow, the local government, to help me to take them and re-establish the program, yeah, which she did. Even when we did our last, program, she brought them, she led them, she led them. She was the head educator of Amu Wadofin local government, even up to now. But anything I want to do, I said, I want this, I want this, I want this. Before you know it is established. Because in each of the local government, I have executives. It is the executive of the old people that manage themselves.
Wow.
You understand that?
Wow.
In each of the local governments, I have executives among the old people. Like I have chairman, I have secretary, I have a disciplinary group. All these groups, they control the program. Even when I'm not there, they will call me on phone. This is what we have done. This is what we have done. I say, okay, it's not this, it's not like this, it's not like that. Do it this way, do it that way. And that is how I've been able to manage them in all the local governments that we have established.
That's fine. You have made it very clear. I'm very excited. That's good. You did a good presentation.
Thank you.
So now you have told me about your structure, how you structure and your policy, how your policy is being translated to actions, which is good. I've understood how it works. I've been in the grassroots. I started in Imo State, and to the point where the governor had to approve the first state conference in Nigeria, which was done in 2019. So I started like you from one community to another. That was how I started moving, interacting with the traditional leaders, establishing community structure using an existing instrument that is already there. So these are what we did many years ago for the past 6 years before I left Nigeria. So I have a lot of first-hand information and experience when it comes to community and social finance management. So now tell me about your financial, you say you've never gotten grants. So the people, which means the old people themselves are contributing to the running of the welfare of the system, right?
Like the financial contribution based on individual, how God put it in their heart. Like now, the program we did last, all members, they donated as per what they can afford. We pulled all resources together and the program was fantastic. Like we did our Thanksgiving after the World Elders celebration of World Elders Day in October 26th. We did our Thanksgiving program last week, in which we have a partner from the church, Pastor James. He supplied the musical aspect of it and the sound system, public address system, and the sound system and the DJ, everything. He used that to support me. And right now, as I am speaking, the United Nations Secretary General, Dr. Luremi, he said he will be supporting me with the microphone. He said he will be supporting the program with microphone. That is how, and other members of the NGO, at times we pay our dues. When we pay our dues, we use our dues to support whatever we have. We pull it together. Right now, we have like 2 people that need accommodation. I have told them they have contributed certain amounts so that we can look for accommodation for them. But the appointment for the accommodation right now is on Monday. And we have gotten about 85,000 on grant for the accommodation. So it is individual as God put it in their hands so that I don't overstress them. I just make it voluntary. As they will, it should come from their heart. Since this is a voluntary service.
Sorry, Ambassador Lawa, the contributions we are talking about, individual, as you said, is it the directors, the executives, or everybody, both the aged ones and everyone has to contribute?
Everybody, every one of us. Both the directors
Ambassador George,
and
is that
the implementers.
Okay.
Both the implementers and the directors, all of them.
All right.
Okay. I've heard you what you said about your finance. I want to ask you, do you have those money that you collect, do you have everything like monthly dues? Because you said something like dues. Do you have a regular compulsory amount? When you say something is due, that word due means it is compulsory. But if it is a donation, you can't use the word dues.
I can't get you, sir.
I mean that do you have like
the contributions? The contributions you talk about, you mentioned dues. Those dues, are they monthly? Is it compulsory for them? Because once you say due, that means it's compulsory for everyone to contribute. So that's what it's asking now. Do you have monthly dues? Is it compulsory for everybody?
What we do is that the members suggested that since the situation is like this, that we should it's even in the constitution that we should have a due, like 1,000 in a month, so that because our program is on monthly basis, so that when we are going for program, we will use this money to buy things to do the program. It is not compulsory, but when they bring it, we appreciate them. We appreciate them and we do the program, and it is on monthly basis.
So what you're saying is that it is compulsory, but it is not penalized. That is what you mean.
No, we are not saying it's compulsory.
Okay, okay. Which means it's not a due.
We are not telling.
It's not a due. It's individual.
A member of one of us suggested that we should be collecting dues, so that we'll be using the dues for the monthly program. But we do it in such a way that it will be convenient for everyone. If you bring it, God has touched your heart. If it's not available, I thank you. And at times, as volunteers, they will not bring the due, but they will present themselves to carry out the service. They have done something.
That's what I wanted to know. It's okay. It's okay. I wanted to find out whether it is
compulsory or not.
Compulsory. I wanted to find out if it is compulsory, but now you've made it clear that it is a voluntary contribution. Yes. So we don't call it dues, please, for your information.
Yes, yes.
If you make it dues, then you're making it compulsory, which is something that an outsider will see it as a method of making money for the organization, and, which is not so, you know.
Ambassador Lawal, are you clear with that? Are you clear with that?
Yes, it's not compulsory. You can have them. You can have them. You can have them.
No. The point is the word you use, deals.
We are not denying.
Once we say deals, that means it is compulsory. So now that is being clarified that it's just voluntary. So you try to work on that word, dues. It's not dues. It's a voluntary contribution.
Okay.
You can regard as voluntary contributions. Yes.
Okay, sir. Okay.
So, what services do your organization render?
Yes.
Just give me a bullet points.
The point: medical services, charitable services. We have our University of the Third Age.
What?
We have our medical services, charitable services, University of the Third Age program.
University of what?
Of the Third Age.
It's cutting. It's
okay, let me explain.
Yes. Maybe you can type it.
University, the same university we know of the Third Age.
University of the what?
The network. The University of what? Type it. Let somebody help you to type it, please.
No. Let us say.
Yeah, University of the Third Age. Have you seen it?
Okay.
All right.
Okay.
Because let me explain that. What we do here is when we gather all the old people together, we want to give them various lectures. Like in the university, we have a coordinator who is a professor. It is headed by Professor Aremu Olanrewaju. So the professor will teach them various skills. He can teach, sometimes he taught them about Agric, sometimes 2020. We have our evidence of various food items that we have for last year World Elders Day, because we went into it, we did Agric, and the proceeds of the Agric everybody, it is clear that this is what we achieve in our agriculture program. Also in the university, we teach them soap making, little things they can do so that they can make money. Little things they can do, they can make money. We exchange ideas, they exchange experiences. We have our game team. Even in the university, we have different lecturers that say different things. Like in the area of music, we have Josephine that is in the program. She's handling the musical aspect of it. When it comes to advice, Dr. Lutimo and some other people, they tell us do this, do that. Like what we like in our last Thanksgiving that we did, we carry out a survey still under the university. We carry out a survey, and under the survey, we were able to administer about 100 questionnaires. And these questionnaires, we have taken it to LUTH, Lagos University Teaching Hospital, for analysis. It's still there. I took it there yesterday for analysis, so that we will know, we will assess the needs of the elders, all still under this university. So all the meetings that we needed, we get it, we approach it through the University of the Southern. Even our sport, we put it under the University of the Southern. So all we are saying is that in the university, they interact with each other, they exhibit their experiences, they learn new things. The things they learn is a continuous experience. Even what we don't know, they will bring it up themselves. Then we develop it. And that is what we do.
I understand.
Ambassador George, do you get that?
I got it.
Yeah, last time they had the World Elders Day, I was there. I was the one that moderated the program as an MC. I think what she's saying now is not getting clearer to me, because that day I was hearing technology, the older, the age ones should bring out their phones. They were teaching them on how to easily operate the phones in case you want to call or you want to record something, maybe audio or video. They were trying to teach them that you don't need to wait for, if there's any emergency, this is how to go about it. This is how to go about it. I think that falls under their university program as they have it.
I understand.
I just want to shift that in.
So what Mrs. Lawa is just saying is that they have capacity building within
that
their
does it. That's the compound name. Yeah.
The capacity, all the stuff in terms of empowerment, training, capacity building are all called, they are embedded in the university. And I also see that she talked of research. What was the content of your research? What was the theme of your research, Madam Lawa? Can you please mute yourself?
Unmute yourself, Lawa.
Need assessment.
Okay, need assessment for older persons, right?
Yeah.
Now,
Ambassador George is also a fellow of IHSD, in case you don't know.
okay.
Hello, please, may I come in here? Dr. Remy Olutumo.
Yeah.
Yeah, I'm also the Secretary General of the United Nations Association of Nigeria.
You are what? The Secretary General of what?
The Secretary General of United Nations Association of Nigeria, UNAN.
Okay.
And I've been with Madam Folorusho for some time as he runs the NGO, and I know the in and out. And I happen to be the one that put up the website for her. Concerning the questionnaire also was passed to me because I was recently given an award. And during that period, she forwarded the questionnaire to me and we both looked into it. The questionnaire is just to statistically look for how the elderly in the MOGA foundations can be helped, how resources can be easily addressed to their needs. And the questionnaire is based on the various aspects of what concerns physical needs of the elderly. For instance, in the questionnaire, they ask questions about what do they want to be the foundation to do for them, and the housing, do they need a housing or do they need this? Based on that, statistically, it will be they will compute it, and then to know that these are the most critical needs of the elderly that will make them glad when it's being done, why these are the least, so that the programs will not just be running continuous programs without addressing the actual needs of the elderly. Because as time goes on, they get fed up that this is just the normal thing we're coming to do normal thing. But by the time they begin to see that their various needs are met, they are happy, they have a home away from home, you know, then the foundation begin to do what is main focus, its main view that it was being registered to do.
Okay. Okay. It's okay. I understand now where you're going. That's a very good. This woman has done quite a very huge job. She has taken aging holistically. In fact, she's running both social gerontology, developmental sociology, and then trying to mainstream it into geriatrics, which is a very welcoming idea. And I mean it that she's going to be a very strong force, and we are going to make sure that we continue to harness what she has started. Now, madam, let's go to your finance. So these small contributions that your people make here and there to support, how is it managed? How is your finance managed? Do you have a bank account with a recognized commercial bank? And how are you financially prudent? Do you give accountability? I don't want anybody to say yes where there should be no, and somebody say no where there should be yes. Nobody will stop us from working with you because, like I said, we have heard about your foundation before now. I just told you to tell you that I have been looking forward to meet you, but God made it to come through another person, not through Mrs. Victoria. And God alone knows why, maybe for tomorrow's sake. Let's keep it on that point. So right now, can you tell us a little bit about your finance? How do you manage your finance? The little money you collect, what you put in as a vision bearer. I know you are carrying a lot of the load and the bones of the whole trouble. How do you still manage it? Because I want you to know that whatever money you put in an organization as a vision bearer is no longer your money. It becomes the money of the organization, including those who did not bring. That is the funny aspect of non-profit. When you put 10 million in your organization today, it is no longer your 10 million. You have to give explanation how you use that 10 million to somebody who did not even contribute one kobo. That is his right. He can take you to court and he can put you to prison for using that money you brought in without telling him how you used it and convincing him that you did it well. So when you go back to your CAC document, you see that everything in an NGO belongs to the federal government in the event of your death and non-continuity of the program. They will return every asset to federal government for public use because it is expected that the money was gotten from the public. So this is one very strong aspect of non-profit that people don't know, that we keep telling them, that you have to be very careful the way you run the finances of NGOs or nonprofit or your foundation. The fact that you are open to collect a voluntary donation from the public makes you compelled to give accountability on how you're using the money. Very important. So can you tell us about your finance, please?
Well, actually, we have little challenge with our account opening. So what we did is one of us, we open a cooperative, a joint account. We open a joint account. Since we cannot open an account for the NGO, so we decided to open a.
Why? Why can't you open an account with the NGO?
Yes, when we were there, you know, I said the NGO has about
The foundation.
The foundation has about 7 board of trustees, directors. So when we get to the bank, all the bank said the federal government has just released an instruction that all NGOs that want to open accounts, they must bring their full details one by one to the number 1 to number 7. And I've been trying my best to get them. Some of them have even traveled abroad. Some of them did not have, their name does not tally with their BVN. So the problem is there, the problem took us down. So, well, because we need to move, there's no way we will be tied down because of the banking, something that we will collapse this vision. We now decided to go the other way around. We opened a joint account. She's there on the platform. She's Mrs. James. She headed the accounting report. She knows how much comes in. She knows how much we spend when we are going for programs. She knows the balance. As we are now, by this December, we are going to give the accounting statement of accounts of all that runs in the foundation from January till date, like we did last year and year before.
Okay.
So that is how.
Okay. Hold on, madam. I understand the challenges you guys face. I know what it means to get the corporate account in Nigeria now, since after the NGO Act was passed in the National Assembly. They are now looking at NGOs and churches with 3 eyes open, no longer 2 eyes open. So I understand. Now, I want to say that financial prudence is one of the very cardinal focal point of collaboration. Nobody will give you money if you don't have a very up-to-date financial system. Do you have statement of affairs? I mean, financial statement of affairs. I don't mean the one that you printed out from your bank statement. I mean, an audited statement of affairs. Of course, I know you wouldn't have. Do you have?
We had the one for last year, but we're about to prepare the one for this year.
Now, if you had audited statement of affairs, which I know an accountant will be involved in doing it, am I right?
Yes, sir. I can't hear you, sir.
Was it done by an accountant? Or an auditor?
Yes. We have We have an accountant as one of the directors in the board,
Okay,
and
so
that is
he
why
did
here.
it. Did he do it with life experience of the expenses, or he just did it as a requirement for all NGOs for all? Because hold on, I want to be very honest. You know, you are a public figure now, and what should hold you is your level of honesty, your level of where you are weak. You make it for us to know you are weak so that we can help. Don't claim to be strong where you are weak, and tomorrow you will be embarrassed in public. And I want you to know that one problem why people are running away from Nigeria is because the leadership don't take responsibility of their weakness. So if you are weak, you accept you are weak so that you can get help and support to be strong. Okay? So financial management is a very big problem for Nigerian nonprofits because they don't follow documents properly. The bookkeeping is hardly done properly. They just do things because they want to satisfy authorities. They don't do things because they owe accountability to their followers. And we are changing from the aspect of you producing audited statement of affairs, financial statement of affairs from a board member who is an accountant, who go out and produce whatever document, put whatever figure he wants to put, because he wants to meet the requirements of the law, not because he is giving response to the people that are following, to the people who are contributing this, their 1,000 every month, to the people who are bringing in voluntary contribution to ensure that this project continue moving forward. So I want you to know that you should be working harder to satisfy those who are working with you, your members, to keep them happy and to keep them responsive to you, not trying to satisfy the articles of the law that governs you as an entity. Do you understand me? Can you understand me now?
Yes, yes.
So you owe the people that, all these old people that are bringing themselves, coming out to stand with you, if you call them and they did not come, then you are nobody. Nobody will know what you're doing. You don't have anything.
Yes.
But because they come, everybody is going to be, they see what you're doing as something that is helpful, that they need in the society for sociological inclusion. And they decided to come. And some of them even spend their 1,000, some 500, some contribute. Then you owe them explanation on how this money is being managed, not to your directors alone. Because what people do in NGOs in Nigeria or in non-profit, the board of directors will plan themselves and they manage the money the way they want. Then the members, especially in a membership-based organization, and the members are not completely carried along with what is going on. So finance is a very, very serious issue that you shouldn't play with. And another advice I would give is, if you have problems with some of the board members whose names are not, you have to bring in new board members, those that have traveled abroad, that are no longer willing to serve the organization, both in providing their documents and everything. You remove their name through a bylaw, and then take the bylaw to CAC, and CAC will replace it and give you a new certificate of incorporation. Then you use that certificate with the people who are willing to give you the real documents to create an account, to have what we call, I saw somebody drop something on the Hope WhatsApp the other day about the school, how to get
School,
a
yes.
yeah. You contact such
Yes.
people, they'll provide school, EFCC security stuff for you.
Have it,
And
sir.
then you have it.
I have, yes.
If you have your school, which means you've done the major work, So what again are we
Yes.
talking about? What you do is that I'm not seeing a bank that will insist that all the 7 board members must enlist. Yes, for the initial time, they want all of them to bring their ID. At least, even if it is 5 or 6, if you bring 6 or 5 of them out of 7, they will still take it. They won't.
They will not allow that.
That's
If I
what they
bring
do
6,
now.
they will not allow.
They
They
didn't
want to
allow
bring
now.
7.
So,
All of them must come.
so who are the people that you don't have in your system? Like, who is the person you don't have in your system that if the person traveled abroad, and can't you contact these people?
One is in the US, and it's like the problem of having details today, details tomorrow, she's tired of it. And others, it could be spelling mistakes during registration, like omission, spelling mistakes. They just discover everything when I said I wanted to open an account. There are many things they discovered there, and we are trying to iron them out one by one.
So how many of the mistakes did you recognize? Did you identify among the 7 people?
About 4 of them. Like my name. My name, the name I use officially is Ayodele Idowu Lawal. But in the registration, there is Folorunso there.
So why can't you take all this correction now and go to CAC and tell them that there was a mistake and you want to a new one, you pay whatever is involved, which is not too much, then they'll produce a new document that will match with the information you want.
That is, I told our legal officer. The legal officer has taken it up upon himself and is on the process.
Yeah, but you people should have a bylaw, have a meeting. That meeting should have a minute. In the minutes of that meeting, that discussion should be discussed, and it should be unanimously agreed that all these systems will be altered, that the board will be altered. What we want to be changed should be specified on that minute, and then you now take the minutes with the resolution and the bylaw to CAC. Your legal officer will take it there, and then they will register you people back with a new system. You're doing a lot of good job. I don't want something like finance to be a problem for you, because no organization will give money to individuals.
Sorry, sir. What he was telling us is that if we go to CAC now to the register, we will start afresh.
No. You are not starting afresh. You are giving them the bylaw of the adjustment, your amendment you have made in your constitution. Mr. James, you saw what we just did on the our last annual general meeting. We submitted our bylaw on our platform, and we also even submitted it on your platform too. So for people to make.
Can I come in? Sorry, can I come in here, please?
Yes,
Dr. Remy. I think this issue of errors and all that was one, we both discussed it. And I've already told her, because that was also what happened with Yunnan, that we have to do some corrections, and also came up with a bylaw in case of any other issue like that. So I've already told her that it's not a difficult thing, not that they are registering it. So maybe after this meeting, I will have a meeting with her, and then we will do the next.
Thank you. Then that's okay. That's good. That's fine. So, madam, we'll close that, and Mr. Dr. Remy will discuss with you after the meeting on the way forward to help you fix that situation, because it needs to be fixed. It needs to be fixed. Okay. Nobody will pay in money into individual accounts. Nobody will support you for no matter whether you call it a joint account. People will not be part of it. no organization will want to be part of it, except on individual basis, you know.
Yes.
And even if it's on individual basis, you can't even declare it as tax because it was paid on individual name, you know. So now I asked you before that how do you manage your money? Do you give account to the old people themselves because they are part of the contributors? Do you give accounts to them?
Who, sir?
Do you give account to the old people about how their money is being managed? Do you talk to the old people how much you realize today, how much you use, and how much is remaining? Do you always share the idea with them?
No, the old people, they don't contribute anything.
Okay, it's your board member.
Everything we do for the old people is free.
Okay.
Everything we do for the old people is free. Everything free.
That is what I asked you earlier. Ambassador Folorenshaw, I have asked you this question because I realized how you put it together. And I asked, the contribution you are talking about, is it your board member, your executive, or everybody, both the elderly ones, the aged ones? And you said yes. Were they contributing?
No.
Those old people you are taking care of, are they still contributing?
We are taking care of. No. No. They are not contributing.
I asked you earlier and you said yes.
No, you can ask them. You can ask them behind me. I didn't hear you well. I'm sorry.
So it was only the executives and their members.
It is the volunteers. We the volunteers.
Volunteers, all right.
The volunteers that are doing it. They are taking care of.
That is why Ambassador George was talking about deals, the deals you talk about. That was why he was trying to correct that, the word deals you use. Because when you want the elderly ones to be paying too or paying deals, that means you are not helping them. It's just like a
no, you are helping them. No. You are helping them. It's not true. When they pay dues, you are helping them. Why are you saying that you are not helping them? You are helping them very well. It's just that we want to know if they are part of the financial backbone of the foundation or there are other people who come in. But you cannot tell me that even among the older persons, there's no one among them that would say, madam, you have tried today, collect this 500 naira out of goodwill. Sometimes it happens sparingly. It mustn't be every day, it mustn't be every month. But some of them will even bring you to bring you something in kind, maybe oranges, that's what they can afford. Maybe mangoes from their farm, just to show that they are happy and grateful to what you are doing for them. Do you understand what I mean? Remember, I've been into community development. I have a lot of experience, both in the north, even in the west. I've done projects in the west, in Yoruba land, and in the east. So, madam, what I was saying is, so how many people are in your foundation in terms of your members, both your volunteers and your members? Are your volunteers categorized as your members, or volunteers are different from membership?
Let me correct the impression. The impression says, even you can make findings.
No, madam. Madam Lawa, wait. You don't need to correct anything. We understand. No. Wait. We understand that the old people don't pay anything. You are not charging them for anything. Everything is free. You misrepresented yourself by saying that they voluntarily. When you said voluntary contribution, we did not restrict it only on your members. We thought that the old people to whom you are serving were open to make this contribution, right? Mr. James, am I saying what is right? Good.
Yes.
So that's what we thought. But now you've made it clear that the old people are not part of the voluntary contributors. It is your members and your volunteers. Now the second question that comes in is, how Are your volunteers the same as your members, or your members are different from volunteers? And then if your members are different from volunteer, what makes somebody your member and what makes somebody your volunteer? Three, how many members and volunteers put together do you have in all these local government you feel you have built a structure?
Actually, I don't have a separate entity as members. All of them that are, they are all volunteers. They are all doing humanitarian job. They are all seeing it as the work of God, project of God, and they are contributing their quota. So if they volunteer, if we are doing a program, their chance, they will come. If they have anything, they support me. If it's not available, all well and good, we move on. With those that can contribute, or one way or the other. Some of them contribute as their effort. The effort they can contribute to the NGO, not financially.
So how many volunteers do you have?
Actually, presently, we have about 50 volunteers in Igondo Ikotu LTDA.
In all the consequences you are working with?
In all the constituencies, I have about 15 of them.
60.
15 of them in Igondo Ikotu LTDA.
You mean 60? You mean 60 or 16? Can you type it?
Okay.
Can you type? Okay, I got it. I got it now. 16. Okay, so how many local government do you have such organization, organized system going on in Lagos?
Presently, I have Igondo Ikotu LTDA. Igondo Ikotu LTDA.
No, tell me how many. Can you type it there? Type it. Type the places on the message.
How many? Are they 5 or 6 or 3? How many?
So let her type it.
Okay.
I'm sorry for. Wow, this is James. Mr. James, your system is a good. That means after this, we are going to talk about. This is where we'll be having our meetings. I don't know what is involved.
That is why we need to meet with Ambassador Andrew Williams Jr.
Yes.
From United States.
We need something like this. We need something like this to be designed for us.
Okay. Yes, the TV this is television, and whatever we say here is being transmitted live from AHIABGA-TV. So Ambassador Andrew will explain more after your discussion.
Yes. Wow, that's a good one. So, Madam, are you still typing?
Yes.
Okay. No, she's on the hot seat. He got to a Ikotu local government. That is one. What about the other ones?
Okay.
Ajẹ́rọ̀mí Ìfẹ́lódùn. Ajẹ́rọ̀mí Ìfẹ́lódùn local government. What's the full meaning of LKJ community?
Latif Kayode Jakonde.
Okay, Latif. It should be typed in full, so for better understanding. Latif Kayode Jakonde community.
Okay, all of them are not local government. Some are communities.
Yes.
No, it's
This one
only
is
this
the
that is
community.
community. The other ones are local government.
So there are
Yes.
two local government and one community.
Yes, this is an estate. That should be
Yes,
an
I
estate.
have explanation for one. I have explanation for one.
Okay, there are 3 local government. Or how many local
Hold on,
government?
sir. Oh,
How
I
many-
have explanation for one.
Okay.
Wait, I'm seeing I saw the third one is what? Is AHIABGA community, right?
Yes.
Yes, that is
I have
Latif
explanation.
Jakonde. Latif Kayode Jakonde community.
Yes.
Okay.
I have explanation
Let her explain.
for one of them.
Go ahead, madam. Go ahead.
Amuwo local government. It has been established and it has been taken over by the local government. And I am happy at that.
Okay.
Because when I got there was nothing like that. Although there was established elderly, they were doing sports. But when I got there, I introduced medical, I introduced many things, even the University of the Third Day, celebration of World Elders Day, and today they have taken it upon themselves to build on the foundation.
So is it strong? Is it strong?
Sir?
Is it sustainable over there? Is it working?
Yes. That is sustainable.
Then this one is Latif Jakonde community.
Yes.
Is it a local government or an estate?
It's a community.
Explain that.
It's an estate. It's an estate.
No. All right.
Yeah. Only we did it at Ikeja local.
Okay.
But it was not sustainable because of lack of funds.
And AHIABGA-TV, I know of this place.
Ikeja local.
Omowo Odofi. Okay, I have that.
Amuwo Odofi.
Yes.
Amuwo Odofi.
Oh, is that Dr. Jide?
Yes, I've been following within the last
Oh,
3
wow.
minutes.
Thank you so
Though I
much.
couldn't get everything.
I'm so happy you are here, Dr.
I'm sorry.
Jide. I'm so happy because you are one of our first night in the West, and I'd like you to be part of this conversation. We've done quite a lot. This woman is a wonderful woman, Mrs. Lawal, the woman that has been working. I've heard about her before now. I didn't know it was her, but I got to meet her now from another direction. So we are trying to see what she has been doing, how we can integrate her program into GCVSI's global vision, and see how we can use her foundation as an implementing unit in Lagos State to reach out to older persons in Yoruba land. And then, Dr. Jide, are you there?
I'm with you.
And then
I'm with you.
we're also following her. She has been bringing up quite a handful of innovative strategies to use while developing an inclusive, social inclusive system that further strengthens the protection of the rights of older persons, even though they are highly marginalized in those communities. So in fact, through her efforts, the government of AHIABGA-TV local government has even incorporated one of her structural programs that she has been able to develop, and which is what we want, government to take responsibility and sustain the responsibility. It's not just to take the responsibility, but to sustain it. That's why I was very keen to ask if when the government took it, are they really doing it the way she has been doing it, or they want to take it and blow the trumpet and then drop it thereafter, make it die, because that is what we know Nigerian government for. So you have to continue with the conversation. We have talked about various areas. She has told us about her programs. She said she provides social services like charity services, charity social intervention programs like to help homeless people, older persons that are homeless. They do food items, that means they support them with food. They also do healthcare. I'll go into healthcare very well because that's one of our pivotal programs we're coming in with. And then we talked about health education, that they have University of the Third Age, a wonderful name that I just adopted here, which I'm going to make good use of this name, University of the Third Age. They have University of the Third Age. What she's trying to say about this is a system where
Capacity
the
building, yes.
entire program of capacity building is being done. So any program of capacity building, empowerment, technology, using trending technological devices to bring in older persons integration and social inclusion process. And we talk about the capacity building in terms of womenomics, trying to empower the older persons in terms of agricultural production and improve agricultural yields. All those things are captured in the University of the Third Age, maybe even health education, awareness programs, they are all captured in that program. And the old people themselves are facilitators. Those who are retired old people that have capacity in various areas, they use them as facilitators to further build and strengthen the capacity of those who don't have. I don't know if I'm correct, madam.
Mrs. Lawa,
Am I correct, Mrs. Lawa? Am I representing you? Oh, her network is up. She will come.
maybe I need to
Madam, am I representing you very well?
She has to
Can you,
unmute
Mrs.
herself.
Lawa,
can you unmute
Unmute yourself.
Yes. Was I
Yes,
representing you properly? Did I speak what
yes,
you?
yes.
Okay. Then Mr. Dr. Jide, we also talked about the foundation, the board of directors. There are 7 of them. And the foundation is also over 10 years old in terms of establishment. It is registered with CAC since 2012 with CAC number, which I'm here to collect. They have never had any grants yet. They just go ahead on individual contribution and donation to support themselves. We mean the board members and the volunteers, not the old people. They also have meetings, like she said, they always have meetings, quarterly meetings. When there was COVID-19 pandemic and restriction, they had a virtual meeting. They are registered too in one local government, and then like I said, individual contributions. Sometimes there was a need for mandatory contribution, but it didn't work so that they won't strain their volunteers and chase them away. So it's still based on whatever you can bring, but the human services is always available. Services they provide, medical services, charity services, and the University of the Third Age, which I've already said. Then they have also done a research, needs assessment research of the old people they are looking after, which they have taken the responses, the questionnaires to Lagos State Teaching Hospital, Lagos State University, sorry, for analysis. That I will still check on what they are trying to analyze. Then the problem of finance, which we are very, very careful. They told us, is Dr. Jide there? I don't think Dr. Jide is there.
I'm with you.
Yeah, in the aspect of finance, they told us about the bank account issue they had. The issue with bank account they had was that there was some mix-ups about the names, BVN and all that. So if there is no accuracy, it's very difficult to get those things established. So they had problems. So they're trying to fix that. But for the meantime, they have they resolved to open a joint account for the directors, which they all manage and monitor. That's it so far before you came into the meeting. So this is where we are right now. So the next question I want to go straight now is, say what?
That was where
Thank
we
you
were
very
before
much.
she dropped. She's not online now.
Oh,
She's not online now. So
she's gone.
yeah.
Okay, is it her
Maybe her
network? Her network. So there are some of her board members are there. So who are their board members that are there? Can you indicate?
Let's allow one of them to say something.
Ogechi Obazie, are you one of their board members?
Or volunteer.
Or
She's sure
volunteer?
Yes.
Hello.
Yes, are you
I'm
one
a
of
volunteer.
are you one of the board members or volunteer?
A volunteer.
You say?
I said I'm a volunteer.
Oh, you're a volunteer. Do you have something to say?
What I have to say is for the study, this is the second study we are doing. We did one in 2014, a study where we assessed the quality of care of the elderly. Then we used those elderly at Igonjo. That's the first thing we did to find out if they know what quality of care they need. And then we're able to find out that they don't know what they really need. And then we capitalize on teaching them those ones from Igonjo. That's in 2014. We're able to do that. After which she then extended it to other local governments. Then it was just the Igonjo only then.
Did you
Later
publish
she
such
expanded to
findings?
other local governments. Sir?
Did you publish such findings anywhere?
Yes, I did. We did. We did
So
publish it in
can we
West
get
African College of
the publish?
the Journal of the West African College of Nursing.
Okay.
We did
So
publish it.
after this, you type us the URL or anyhow we can be able to get access to that journal so we can read.
Article, okay. Okay.
I will need it later.
I'll do
Then
that.
Mrs.
Okay.
Josephine, your hand is up. So Mrs. Josephine, can you talk to us?
Oh, okay, I'm just indicating that I'm part of the volunteers as well. So
Okay, so can you say something? Your hand is still up. Can you please put it down? Is your hand not heavy? Are you not feeling pain? Put it down. So Josephine, can you tell us?
okay,
Tell us what you want to say. Yeah.
So I know that it has not been a
I
very
can't hear
smooth
you.
journey.
Can you speak up a bit, please? Thank you.
Can you hear me now, sir?
Yes, I can hear you now.
So I said a smooth journey, but I know so far so good. She has been very wonderful boss, so to say. I don't want to say boss, but at the same time, I don't know what best to call her than my boss and a mentor. And working with her has been, doing this stuff, this NGO work with her has not been very easy, but at the same time, we bless God because it is an act of humanitarianism and that we all love to do with her. And I know, for instance, I happen to be one of those people who started with her from Fakoji. I remember then she had about 1,000 to 1,500 people that takes care of back then, even with her own salary. As at that time, I remember none of us were contributing that. She single-handedly did all those for about 5 to 6, 7 years before she retired, and now had to start putting our resources together. So I remember then that most of these local government, I know at that time they took it from her, and the government took it from her, but they did not manage it well. It was not managed at all. Because if we go back to those local governments now, I'm very sure that I know it's not like when we started then, because those, you can see the glow on those old women's faces and the smiles and happiness, but now you can't find it there anymore. Those things she was looking out for, those dreams, and we really do not want these dreams to die. We need probably your ideas more. You can help her with that on how to go about this thing so that it doesn't just die. It doesn't just go, our effort doesn't just go in vain, because we know that this is what she would always say the Lord calls her, and we all know when all this thing started. So, but so far so good. We still have some challenges with the one she is having presently, but I know that it will be fixed. Thank God for the life of you, Mr. James, who has been Dr. James, who has been very helpful too, and for everyone who is here. So that is all the little I have to say. I don't want to talk much. Thank you, sir.
Okay, that's fine, Mrs. Josephine. I don't know if I'm correct to call you Mrs. or Miss or Lady Josephine Okay, that's
Yes,
fine. Thank you for if this
Sorry,
is
the pronunciation of her name.
Mrs. Josephine. I don't know what's the next the other name. Okay. Is Madam Lawa back? Because we are 9 now. Is she back?
Yes.
She's back. Okay, our host is back. Madam Lawa, you are the star of the day.
Thank you,
God knows how to bring people out who have suffered for something. So don't feel that you go retirement and die off just like this. It's not possible. God is God.
Yes.
Those words that those old people always tell you, thank you, man. Ekaro, thank you. All those words, all those thank you and thank you. God will bless you. It's not for nothing. It will come. When I started some years ago, I was like you know, they were telling me, thank you. I don't want to talk my story right now, but it's not for me. Let's move down to another thing. But now we've seen the structure. I think I have a very deep analysis of who you are right now, what you do, because I reported it to Dr. Jide, and I guess you said I was correct. Now, the major places we want to go now, these areas, these other places you have structures already placed. You have focal people there, committed volunteers that are knowledgeable that can function properly to coordinate.
As Ajeromi Felodu, like I said before, as Ajeromi Felodu local government, I have appointed a focal person and she's doing very well. Even after the celebration of our World Elders Day, in our Thanksgiving, she brought those women. They were here with us. We celebrated together. But that of, like I said, that of Amu Ward Trophy, since they have adopted it and they are doing it the way I wanted, I don't bother about them. They call me for consultation. I give them lectures. Even till November. Even the celebration of the award Elders Day, I said they should not worry. Since they are doing it well, let me come over instead of them coming to me to satisfy the chairman, and he's doing well. And I'm okay with it. For that of Ifakoja, a local government, I told the madam, the chairperson then, that I am not too happy that this program is not sustained at Ifakoja. And I have told her by next year, we are going to do something. And I'm going to appoint a focal person because I have nurses there that can stand in for me to handle that local government.
Okay, now we're going back to the very, Dr. Jide, Dr. Jide, are we there? Okay. Okay, we are going back to a very deep, one of the very fundamental parts of why we are here. How do you deliver your healthcare to these old people?
Ambassador Lawal, is she there?
I think the network swept her out, but she will soon come back.
I
So,
think,
the director, I think we have Dr. Remy. Dr. Remy,
yes,
are you
Dr.
there?
Remy. Or any of the volunteers who can
I'm
talk.
still here. I'm still
Dr.
here.
Remy,
Olutimo.
Yeah. Sorry, I have issue with African names, even in Igbo names, I can't call them. I was not born there. I was not. I didn't school down there when so I'm still struggling with that. Anyway, what I want to say is, are you aware of their healthcare system and what they provide to other persons?
Yeah. In collaboration with United Nations, MOGA Foundations has been giving out, delivering a good health care. For instance, now, though it's part because two of us, we had a meeting, both I and Mother Lawan, about the next phase she's looking at. And the next phase she's looking at is an elderly home, the healthcare center, and a center that they can call a home from a home. I was even telling her that, okay, I have a land somewhere in Ogun State around that side. We live in is far. So I just said, don't worry, God will encourage, God will provide. There will be a kind of provision so for you to get and establish that home. So we also talk, and I told her she was not talking about tour. I said, okay, fine. Let's put it as a kind of, in few years to come, that the MOGA Foundation is going to have a trust that it can, the elderly people can, maybe all these medical items, medicines, or where they provide, they cannot afford it or they don't have, they can come to the trust and the trust can subsidize it for them, can get them there. So it's going to be a kind of a center the federal government can emulate. In fact, it's through MOGA Foundation that I was able to address the government through the LTV, and she too was part of the program. And within a few months of that program, just a month after, the federal government has taken drastic step of addressing the needs of the elderly by giving them ID card, which is one of the things I itemized, give them ID card, subsidize them, provide a kind of amenities for them, an environment, a policy, not a policy after this government, the other government we trashed, a policy that government go, government come its way. So regarding their healthcare system, this is the way they are doing it. For instance, during the Elders Day, various like NGOs and other individuals who are also into NGO healthcare facility, they come there, and before the program begins, they provide a kind of medical care checkup, diabetes, high blood pressure, eye care, the eye tech center, and they give them free glasses on that day. So, and then when United Nations is having their own for their elderly and all that, MOGA also come there, and some of the NGOs that have been partnered with MOGA, they also serve as a support to the United Nations. So these are the way the MOGAs have been by individual or by NGOs or foundations who are into medical. They're the one that comes and offer and give free medical and free support to MOGA. So being empowered today, I believe that MOGA will know what to do, because I think that is our strength, that is our fit, being a retired nurse and a well qualified for that matter. She will know what to do in addressing the needs. I think that is one of the the questionnaire also, just to know what medical they are looking towards. And with that, she'll be able to have a very good healthcare. But for now, the healthcare that is being followed or being this is the one that NGOs, well-wishers and all that bring to support wherever there is a major activities that MOGA is observing for that particular month or weeks.
You talked about food program. How do you conduct your food programs? Dr. Remy, do you know about their food programs?
Food program.
Mm-hmm.
Yeah, you know, like she said, at least I'm one of the beneficiary of their Gary. I'm still drinking it. You know me, I'm not a friend to Gary. But since she prayed on the Gary and then said anyone that drinks it, so I believe that prayer. So that day, I just hang it on the
what
on the
I'm
rooftop.
trying to ask is that the program, what I've come to understand. So, Josephine, tell me, do you have an alternative do you have another version of the healthcare that your organization gives?
Is it the UNAN or the MOGA? MOGA Foundation.
The organization that Mrs. Lawa is heading, what's the name?
That's the MOGA.
It's MOGA Foundation, Mercy of God Foundation.
Can you write it, Mrs. Lawa? Can you write it down on the chat?
Mercy of God for ages.
Mercy of God
for the Aged Foundation.
For the Aged Foundation. Now, Josephine, can you tell me if you have, Dr. Remy, were you saying something else?
No, you were saying something, so I'm waiting for you to conclude.
I'm talking to Mr. Josephine to tell me, is there something Dr. Remy has not put that you want to say about the healthcare system you people provide?
Okay, so care service before we get some from at first we get medical care or drugs from the resources we put together at first. Then at the point we started getting support from the likes of Fitting. We get drugs from them, then supply to that we get group of nurses, because she has colleagues that come some of our programs that we do every month. So when they come around, they check their blood pressure, and they get an exercise book for them where they write down all their health cases. Then if there are drugs at that moment that they can prescribe for them, then they give to them, or if not, they refer them to a hospital. Then there's always a doctor on ground that writes all those things down for them. Then they take them either.
So they did not share. You're trying to tell me that what you people do is outreach.
Well, because we are converged, we say it is an outreach.
Yeah, it's more or less like
outreach, yes, because outreach is a medical system that it's not consistent, it's not sustained every minute. People can access it every now and then.
Yes, you're right.
medical.
Yes.
Okay, that's what I want to find. So, Mrs. Lawal, can you tell us more about your food program? Is it an integral part of your healthcare program? During your outreach, you also make sure that you provide food, or is there a separate food program you're running?
Yes, the program, we run it on monthly basis.
The food program?
Whereby we...
Food program.
The food program. We run it on monthly basis. Okay. Usually the third Saturday of each month is our program day. They know
for what? For health or for
before
food or for both?
They are gathered.
For health or for food?
For health?
That takes
before 7, 8
is
they
it
are
for
gathered.
health or for food?
So I just come to their meet, we see their blood pressure, we check their blood sugar level. We give drugs. We give drugs where the need be. We have our doctors, they will check them. Eye glasses, eye screening. We give health education. We do exercise. We end the program.
All right, Mrs. Lawa. Hello, please, it's as if the network is back. Can you hear me?
The network is bad, sir. The network is bad. So basically what she's trying to say is that we do all these things on that same third Saturday of every month. We run everything, we do their checkup, we give them food, we take care of them, we want to exercise. So we do everything just that one Saturday of every month, sir.
Okay, so that's the question I was trying to find out. That when you say you give them food, you give them checkup, you give them dates, every month, which is that third Saturday of every month. I now ask a question that, are you running a food program that is compulsory, that every of that third Saturday is compulsory that each of them must go back with food?
Yes, sir.
Is it compulsory that each of them must go back with food? And what kind of food do they go back with?
We share like 2 kg of wheat, either wheat or semovita. It's very, very compulsory. We give that to them every third day, sir.
Is that what you will give to them every?
Yes, sir.
Madam Lawa, hold your peace first because the network is not good. Mrs. Josephine is helping us first. So you said that every third Saturday of every month, people make sure that they go with something to eat, like at least 2 kg of semovita or wheat, right?
No matter how kg, but we give them either wheat or semovita.
Okay, that's all you give to them.
Yes, sir.
Okay, and then the health care is compulsory that you must give them. Is it compulsory?
We do training on University of the
on the health. They make sure they check.
Can you, Mr. James, can you mute Mrs. Lawa? Mute her for me.
I'm supposed to mute her.
Yeah, mute her so that she will know that somebody can put her to order. Mute her, Mr. James. Let's do her like Buhari. So, Mrs. Josephine, go ahead.
I can't hear you again, sir. Sir, your mic is muted.
Me too. Okay, I'm here. Go ahead.
So as regards the health, they actually make sure they check every third.
What do you do
Saturday.
in your health? What do you do that day for them? What do you
blood
do?
Pressure, their I think their BP. BP is still blood pressure. I know they do. These are the ones that handle it most of the time. But majorly their blood pressure, they check all those and they write it down. So give them preferred drugs if we have them around.
Do you offer them drugs?
Yes, when we can give to them, we give to them. Because we have doctors.
Which kind of drugs do you provide? Drugs for hypertension, drugs for hypertension. So
yes, sir.
Who certify the fact that this drug should be given? And do they have established medical cases before they?
We have doctors for those programs. We have a certified doctor that comes, so he's always on seat.
I know, but you should know that a doctor cannot certify a hypertensive patient on one sitting. You cannot just see an old man today and certify that he is hypertensive simply because his blood pressure is high today. You're supposed to have concurrent examination of that person to be able to say this person is hypertensive. You don't just declare somebody hypertensive on first contact.
No, I think most before
These
they,
are the people managing.
sir,
James, what did you
give
say?
them,
I think these are the people they have been managing.
yes.
I
That's
think
what
they
I'm
know.
saying. Which means they
Before,
already established cases of chronic
Yes,
disease
yes.
with them.
Things like that, yes.
Hello, I can hear you now.
Yes, I'm coming back to you. You know, you are not the only
Mrs.
one.
Lava, you muted
We're trying
yourself.
to validate. We're trying to validate all the things you've been telling us.
You
Okay.
unmute yourself.
No, don't unmute her. Leave her. As far as she's not talking, let her be there.
Okay.
Don't talk. Just stay and be watching. We are trying to validate and affirm what you told us. If what you said are all
Yeah,
true, because
correct,
this is the
correct.
way we get empirical truth findings. So yes, I'm taking that. Are your food supply? So do you have any standards for giving food, Mrs. Josephine? Do you have any standards, established standards? How do you check those who need this your wheat and your semo? And why wheat and semo? Why just those two things? And how did you come to the realization, the conclusion that food, wheat, and semo should be given? Is it medically advised? Are they having problem of diabetes? Do you have vulnerability capacity index that you use to check that yes, this person has a problem of family structure problem at home? Is there a gap in terms of nutritional assessment? Do you do ampogeometry survey to establish the nutritional status of these old people? Or have you been able to do the Minitab nutritional assessment procedure to find out that these people actually need this food? How do you come to the arrival? How do you arrive at giving people wheat? Old people of 70, 80, you are giving them wheat and semo. How do you come to this conclusion? Mrs. Lawal, if you can help. Mr. James, can you unmute? You can unmute her.
Actually, we give it based on what we can afford at a particular time. Not only wheat and semo, we give black plantain.
Okay.
We give gari, the gari that we harvested in our farm. We give black plantain.
What do you mean by black plantain? Is it green plantain?
Yes, yes. We give it because we have it in our farm. We harvested it in our farm. It is evidence-based. We give vegetables. We give them vegetables from our farm.
Is it every Saturday you get vegetable from your farm to give them?
No, no.
Which one do you give consistently? Which one do you do consistently?
What we give consistently, we give semovita.
Good. That is what Josephine said. Semovita.
Yes, we give semovita because whatever we can afford at that particular time, we give beans.
Absolutely. Now you're telling me. Now I understand your program now. It's okay. Thank you so much. I'm clear with that.
Ambassador George, I think that is clearer now.
Yes, it's clearer. I'm very clear.
Based on what is available, what is on ground.
Yes, I want her to be very, when you are working for people and you're working for people's interests, be as plain as truthful. Let people love you because you even expose your weakness. People can even like you more because you said what you cannot, your weakness, and they decide to like you and help you. But don't try to use the Nigerian government system where they cover everything and cover everything until they get to a point where they can no longer cover. Then the one they have been covering since 10 years now exposed on the last day, making them very open and very, very stupid. So we shouldn't do that. Most non-profits in Nigeria are operating like government. So that's the problem of funding. If you look at what Madam Lawan is doing, she's doing one of the very key service that every community needs. But you see, the biggest problem why people cannot work with her because she doesn't have a financial record. She doesn't have a prudent financial management system. It's not transparent enough, beginning from where the money enters, accountability, responsibility, and other things. But if you come to the passion, if you come to the zeal to do, if you come to the professional, technical know-how and community mobilization, need assessment methods, community mobilization structure, and all those things, she can do it. Because for you to influence people in different areas to set up a system, and they are there, even without no money given to them, it means that people believe in your leadership structure, your leadership style. So the biggest problem now is funding. And how to fund it? Anybody that gives money is the powerful man. He that brings, America has money, that's why they are powerful. China is has money now, so they are becoming powerful all of a sudden. So if you have money, you are powerful. You become a stakeholder.
Everywhere.
Decide what happens. Yes, that's it. They say he that do what they, I don't know how they always say that statement. They say he that pipe the pipe and detects the toll. Is that not what you always say in Nigeria? So, madam, are you following what I'm saying?
Yes, sir.
Madam Lawa,
Madam Lawa, don't be
this
weak.
this
Don't
your
be
show
weak.
shake, sir.
I'm you. I'm being very plain. I am criticizing you constructively so that you can
Yes,
know.
That will make me stronger.
Yes.
That will make me stronger, sir.
Yes, we are criticizing.
To make me do the correction.
I'm criticizing you constructively so you can be able to reposition yourself.
Yes, sir. I like that.
Yes.
I like it.
And I'm doing that professionally. I'm not doing it sentimentally, right? I'm just doing what I'm supposed to do like a journalist is doing it. I'm a public policy developer, so I know what to criticize, when and how. So now, madam, we have seen what you have. We've seen what you offer. We've seen your partnership structure, and we've seen all what you do, your programs. And now we want to come in with you. Now, GCVSI, which is Geriatric Care and Vulnerable Support Initiative, it's a 501c tax exempted nonprofit in the US. Here in Canada, then we are registered in Nigeria where we began, and we have implementing units like you in Cameroon, where I was born. I was born in Cameroon, so anything I do, I make sure the people who hosted my placenta also benefit from whatever I do. That is it. Yeah, that is what nature should be, because I have a history with them. So now, GCVSI, we are a public health focused organization, right? With 3 thematic areas: older persons, pregnant women and children under 5, and then homeless people. Majority of our homeless intervention program are done in the West, in Canada and in America. Because here we have a problem of homelessness more, and government does not know what to do. That is one place in social integration that has affected the Western government, because government cannot provide home for every homeless person. So at the end of the day, you see a lot of them hanging in the metro station. They need to eat food, they need something to cover themselves, especially now that the weather is too cold. They need shelter where they can go in. So this is where we do most of that program. But in Africa, we do social determinants of health. GCVSI is there to bridge the gap between the rich and the poor. And then we take research-based health information. That's our mission. Research-based health information, healthcare services, plus social support programs to the doorstep of the aging population and the vulnerable population. And among low-income families in mostly disadvantaged communities, in rural communities. That's what we do. So, and then our vision is to see a society of equal rights for all age groups, where institutional and systemic marginalization and discrimination against certain age will be eradicated. And then we also continue to provide research, evidence-based research that will attract government's attention to abandoned and forgotten realities. Sometimes government forgets their responsibility. So we go to those places they have forgotten and do research and bring data that we can show to them that will make them come back and say, no, we need to touch these people. That's one of our vision. That's one of the focal point of our vision. And then to bring a society where there will be no ageism, whether you are an old person or you are a young person, because young people also suffer from ageism, you know. So that's our vision. Then we address social determinants of health, like I said, providing health and social services for communities, for low-income families in communities, focusing on the arithmetic population, which I've already mentioned, to make sure that these people also have social inclusion policy. We do this through advocacy with government for increased financial budgetary allocation to social services for these people. We also do so through research, like I said. We communicate through communication, and we also do so through community action, where we implement projects in communities like what you're doing. We also do community advocacy, community need assessment, research, and mobilization. So we also do so through communication and conferencing, where we create awareness, sensitization, and then we provide healthcare services. We establish a structure, a clinical intervention program, following WHO guidelines and standards. So in GCVSI, is Madam still there? Madam Law, is she still there?
No,
She's up.
no, it's up. But the volunteers are here.
Why is she the only one having the network problem?
No, she first she's in the hot seat, so she has to go and
Okay,
take cold
pull
water.
off once in a while. She will pull off. I understand. Me, I was even sleeping. I forgot. I didn't sleep last night. I'm preparing some documents. So I watched my time. It was 1 hour to the time. I slept that I'll wake up. All of a sudden, I discovered I was almost going before you came. So if I was really attentive and ready for this, I could have bombarded her with more better questions. Just that me, myself, I'm weak. So we need to go ahead. Josephine is here. I need her to come up so that she will understand how we operate and then what
She will join us. She will join us, and thank God for the other.
And Dr. Remy is also there. And then let me type our website. Let me type our website. That's our website. And check us out there. www.gcvsi.org. If you go to Facebook, you can find us with GCVSI, Facebook, Instagram, Twitter, and LinkedIn. Okay. Okay. Mr. James. Somebody is on your, who is on your background, Mr. James? Somebody, I'm seeing James. Okay. She has not come. So what we want to do now is that GCVSI has, is Dr. Jide there?
I am here.
Okay, you are back. Is Dr. Jide there too?
Sorry, why is back?
Yes, but I'm just taking an excuse that I have to leave. I'm still here, but I want to. But
Okay, yeah, Dr. Jide, at least you've gotten a rundown. Later, me and you will talk personally on this thing.
Yes,
And then
yes. And I even I can have
I
access
just
to.
wanted you to see what you have seen, be a
Okay.
witness of what is here. You are somebody now that we have in the West, that whatever we do comes from your advice. You understand? So
Yeah.
you are our member of advisory council from there. You have to put us through. So
Okay.
we need you to, anything that concerning the Western region, you must be at the front line to give us direction on.
No problem. God will help us.
Yeah. So after, me and you will have our own direct meeting to assess what we have.
No problem. No problem.
I know you're very tired, even me too.
In fact, I was even feeling sleepy while holding.
I know, you told me. I'm so happy that you honored me in the first place. Thank you so much.
Thank God, yes. So maybe if I have access to the recordings, I can listen
and
to
they will
it
give
over
us,
again.
they'll share the recording, then I'll still share it with you. Then we'll play it again together and see what we can do.
Yes, so maybe by the time I listen to it again, I'll be able to analyze things. So I will be able to, that will help our further discussion.
Okay, thank you. So, Madam, okay, now, Madam Lawal, are you now representing James? Mr. James?
I'm here.
Is Mrs. Lawal there?
Yeah, yes. I thought I saw her now, but she's out again. I didn't know how come our own thing came in as James Messi again.
So,
okay,
Mrs. Lawal, can you hear me? Can you unmute yourself?
Okay, sir.
Okay. Now, what we do is that in GCVSI, we are operating in an African regional approach to public health and social determinants of health. We are doing provision of pipe-borne water in communities. We provide pipe-borne water in communities that are lacking pipe-borne water.
Okay, sir.
And the kind of pipe-borne water we provide is the type that we don't need NEPA. We don't need anything. This one that they can use their hand and just once they press it down, water will be coming out. They don't need more, because the problem with Nigeria is sustainability. We don't want anything that they will need generator before they can pump water, or they need solar. We provide a manual water system so that any person that can just press it down can be able to get water. Do you understand me?
Yes, sir.
Okay. Second thing we do is that in our social determinants, we provide healthcare services. This is where we are working with you. Now, in our healthcare services, we do what we call, WHO has a document, a policy document of the WHO management and control of chronic diseases in low and medium income countries. We call it, WHO has a policy document on universal health coverage. And then WHO also have a policy document on the institution of community health workers program. So these three different documents, we have put them together and develop an implementation science, which we use to provide our intervention. One, we provide access to medication for chronically ill older patients. What do we mean? Old people that have chronic diseases, diabetes, hypertension, arthritis, and so forth. And we know that they are the poorest of the poor in the society. Government has in fact refused to give them what they have to get. Corruption has finished the remaining one that is even supposed to come to them. So we decided to provide access to medication, which is our program for Africa, where these older people will have access to this medication on monthly basis. It's a prescribed drugs that comes to you, to the community health worker that we are going to train. So you now, these community health workers will be trained and live in the community where they are serving. We don't want people that live in the Ogbomosho and they are serving in Amawodofi. That is what is destroying rural health, health structure in Nigeria, where the local government health centers cannot function because everybody lives in the city and is working in one local government in the bush. You go there only once in a week. So we don't want that. We are working with community health workers. We train them, and then they must come from the community where they are serving. They must work with the local leaders. When we say local leaders, the Oba or palace must know them from that community and provide and accept that they are there and they live there. And then we will now start with the research. We have a research template that we are going to do training online like this and give them facility. Then we have our country representative that will also be there to work with you, because you now will become a focal person that is going to mine all these communities that you have established to have a sustainable program. What you need is a sustainable program that is not something you do again only every month. You do it, you are sure that this program runs every 24/7. If, for instance, a community health worker is conducting care at a clinic, may decide to post clinic 3 times a week, may decide to post clinic 2 times a week, depending on the number of people she is serving. Let me say there are 50 older persons in his community she's serving who are registered. And she cannot handle 50 of them in one day. She can decide to divide them into batches and tell them that, okay, this month we will come 3 times. 15 will come today. The next week, another 15 will come. And then the other week, another 20 will come to make it 50. So that it will be easy for her to manage. All we know is that before the end of the month, let the data. We have a software that is hosted in the cloud. This software is in the cloud. Then we have a device like a phone, but it's a tablet. In that phone, it is only our software that is contained in it. Do you understand me?
Yes.
That phone has only our software. Then that software has everything you need about the old person, like a Facebook just like a Facebook page. If you put the password and the PIN, it will take you in. Then you want to store the patient's data. You can do it offline. You can do it online. You can put in the patient's data there. Everything is calibrated in the software. And then there is a place for thumb printing where you have to snap the patient and you have to take the person's thumbprint for that month, for that service you did for that month. That is the thing that will make us validate that the drugs we gave you for that month, for that person, the person actually took it. No two persons have one thumbprint. The corruption in Nigeria has destroyed every effort. So the only way now is through thumbprinting. It is taking us a lot of money to produce this device. Imagine how much millions of naira that could have been used to help people if we were sincere. But because of the fact that you pack medication and give to people, to give to old people, they will use it and go to pharmacies and sell it. So for us to be sure that, I think I'm beginning to be dark. Hold on, let me put on my light. Ah, sorry. Sorry, I didn't know I'm getting darker like this. Can you see me now?
Yes.
So we have a
Yes.
device like this. Then we have a software. That software is capturing the device like a phone. For instance, if you have a phone like this now, this is a phone. You have different applications. All these things are applicable, like Facebook. This is Facebook. You just touch it. But our own will have only that our application. There will be no other application there. It's only that our own.
Okay.
So that when you just touch it, like, for instance, this is Fidelity Bank. I just touched Fidelity Bank. You see what it's showing me? It's telling me to what? To have access. You see what it is? If you put the password and the username, it will take you into the software. When you get to the software, you have geriatric, community health worker. You touch it, it will open you geriatric. Then there are different communities with their titles and their names. If it is your community, you touch your community. And then each member of your community has a page, an account like Facebook account. And this account, we have all their data we have collected before they started the program. We have forms we are going to give you, data collection forms that you are going to use to capture all their pre-assessment forms. They are all captured in the system. So as you are providing services, you are recording it there. You may record them in the form and later you transfer them in this device. Or you may record them in the form and then transfer the form electronically to the center where the thing will be put to the device. But you must take the thumbprint of each of those people and their picture every day you have contact with them. Do you understand me?
Yes.
You take thumbprint, your volunteers that are wherever they are, they must take thumbprint of these people wherever they are. If it is food program, because we are running World Food Program, where we give these people food according to their vulnerability index, all those things will be assessed. We have assessment forms for all those things. When you assess people, you don't give everybody food. There are people who are supposed to are in need of food. Then we put them under vulnerability index. Do you understand me? There's somebody whose problem is just his medication. He has children that give him food, but he needs help for his medication. We put that person under medication and will not spend the money and the resources to give her food. Do you get it? Then if there's
Yes.
somebody that is a man without support that needs food and medication, there are vulnerability factors that we are going to catch. Once we catch those vulnerability factors, we are going to be able to assess that this person falls under the World Food Program and the person is part of the World Food Program. So each month that you are giving the person his medication that will take him for 30 days, a hypertensive patient sometimes lisinopril, hydrochlorothiazide, or nifedipine, whatever they may be consumed every day. It goes most times, they take it every day to sustain themselves. So we give medication that will go in for 30 days. Diabetes patients, the same thing. Arthritis, the same thing. And other diseases that we are going to put as our baseline. Then, when we give this medication, your role there is to make sure that the medications are given, their blood pressure are checked, their BP are checked, yes, their blood sugar, cholesterol. We also give all the test kits. We give you electronic weighing scale that has BMI, that has height, that has weight, everything in one place, machine, so that you will not be doing manual recording and making mistake. Everything is electronic. Your thermometer is electronic on the forehead. Everything is such a way that you don't have to stress yourself much. And you don't make mistake in giving us data because we need the data to be accurate. Then there's a social segment, family support structure. In the rural community, the volunteer will know these people, know them to their homes. You also organize caregiver support structure. All these people that are participants of this project, their family members must sign a consent form to be part of the family support program. One member of the family of these old people must be a caregiver who is responsible for this person. And these caregivers too have their own training. That month where you are giving the old people food, they must come with their caregiver before they collect their food. That day they come with their caregiver is the day you are giving the caregivers training, how to manage old people at home, how to communicate with old people that are beginning to lose their cognitive function. These are the problems of older persons. When you go back to their houses, the way they are treated, the way they communicate with them, the way they are being messed up around, their human rights are violated from their families. They are socially excluded in decision making. Sometimes their properties that they had when they were young will be negotiated and sold behind their back without their own pre-knowledge. Maybe that man does not want to sell that property. He wants to see his property until he dies, but his human rights will be violated. So these are things we are going to be teaching the care family support program. We will give you educational knowledge program that you will be teaching them on monthly basis. How to live with your old father, how to communicate with an old man who is losing his hearing problem, eye problem, how to make an old man feel inclusive in the family, how to care. It's not about asking your old man to go and bath. Sometimes you need to go and warm the water, take it to the bathroom, and then just tell him, okay, everything is ready, go and bath. He may go and bath. But when you tell him to go and begin the program by himself, the process of taking his bath may be too heavy for him and he will fail to take his bath for that day. So how do you talk to him? You don't expect your father that was very attentive 15 years ago to be attentive the same way today. He will have a reduction. So these are things you start teaching the people who are living with these old people because they are the highest problem the old people have. You may make them smile, laugh in your occasion, those days you take them. When they go back home, they find people whom they cannot communicate with. They find people whom they cannot live with in peace. People who socially exclude them, who continue to threaten them. Some even beat them. You check them. When they come to you, you check their body for abuse. You ask neighbors who are around, how is this person managing this old man? Do they always fight? Do you have problems? The old man might not ever tell you, because if he tells you and go home, he will receive another beating. So you have to make effort to visit these people. You are the volunteer who is at that community. You visit these people once a while to see how they are doing at home. So this is the way we are running our program. Now, they call it WHO Aging in Place and Sustainable Development Goal approach. In Africa, we don't take old people to old people's home. Most cultures don't allow that. We develop a system where an old man will be in the community where he or she is aware of and is aging in that community, with the resources growing with him or her in that community until he gets old and die off. Do you understand me? So it is a streamlined, well-developed structural program that it is both research, it is at the same time you are providing healthcare services, you're providing social services, that your university of the third age can now come in when people know that they are benefiting something from you. You find out your university coming in. During your program, you can bring somebody who is in charge of health education. The person will give the talk. During your program, you can bring somebody for capacity building on modern technology, like how to use phone. Catch them within that setting of that community. You don't need to build a home. I am not saying that a home is not important. A home is very important in where the resources is sustainable. You can build a home is one thing. Sustaining that home is another very big thing. But when we have a community resource center like what we are developing in different communities, it is something that you don't need much of the infrastructure, but you need much of trained personnel, much of materials to do the work, the equipment, and then it is a mobile clinic. It can be moved to any place. Do you understand what I mean? So you tend not to spend more on infrastructure, but you are providing the same services that the people with infrastructure can provide. This is an African or a low-income approach to care of older persons, meeting up with WHO guideline on community health workers, WHO guideline on combating chronic diseases in low and middle income countries, WHO guideline on aging in place and sustainable development goals. The three of them, we have brought them together, we coined them together and developed a strategic intervention program that will give us feedback on public health, non-descriptive epidemiological research, which is what we call cohort studies, because you will take all the baseline data of these people. Before you met them, you have capture all their data of their condition, and then you follow them through. After 1 year, you will analyze their same data, and then you compare it to the time they started the project and see the impact you have made in their life. They call it cohort studies in public health. Madam Lawan, are you following me?
Yes, sir.
So you are now about to get into real geriatrics and gerontology. This is what you do now. You can just tell somebody that you are taking care of 1,000 old people in Lagos State, And nobody can argue you because there is a system. They will see all the program, what you do for them every month, their BP, everything is captured. They will see when they came into the program and where they are now after 6 months. Their testimonies will be there. Their indicators will be showing that that person that was having hypertension every month, since he started coming to your program, the BP is now stable. The stability of his BP is showing that the drugs you're giving to him is working. One of the reasons why people have chronic problem, is because they don't manage chronic diseases very well. So we are going to use the best pass principle of WHO approach to chronic diseases in low and middle income countries to be able to get this done. So this is where we are coming. The same thing with our World Food Program, bringing these people to start benefiting from food every month. Now we are giving them proteinous food. It's no longer that soybean, eba and plantain and this. Yes, we'll mix them. We'll have vegetable. It's no longer only going to come from their farm. We are going to have people that bring vegetable from village markets. You will have people who go to village markets to bring vegetable. They know how to tie the vegetable for each of them. We give them soya milk. We give them a crate of egg. We give them then this thing, semo can come. By the time you join the combination, you know the kind of food. This food can take this person for 3 weeks before the person will come again the next time. Are you following what I'm saying?
Yes. Yes.
Madam, are you following me?
Yes. Can you hear me?
Yes, because our programs are capital intensive, we follow them up. We don't play with tracking. Because their programs and Nigerians can bastardize at any time. We don't allow, there is no reason on earth you will tell us that somebody collected something without the fingerprint. The fingerprint must appear in our cloud, and I will be in my house, in our office in Texas, in America, our international office in Canada. We'll just go to our website, go to our software, and we'll be able to see, okay, let's go to AHIABGA-TV. We'll touch one AHIABGA-TV. Okay, we'll start checking for the month. We want to see all their thumbprints there. We want to see their picture there that was captured for that. The dates which the picture was captured will be attached. That's the way the software is developed. Everything you do for that day, the date is attached, the time is attached. So you cannot change anyone for another one. So if you gave food to 200 or 300 people, you gave medication to 500 people, we should catch all of them their thumbprints and their photo for that month.
Yeah, Ambassador George,
yes.
I think our time is up. Maybe you should just round up our program.
Yes,
Then
we'll
freeze another
so, Madam,
time.
yes, Madam, this is where we are. If we have to work with you, we will provide this capital and we'll also provide these resources, and they will also provide you with those volunteers with resources that they need, because we know they have their families, they need to feed their families too. For doing that work, we also put them on kind of salary so that they can do their work, know that they are not just doing humanitarian work, now they are doing a paid job for which they are trained for. So this is the two programs we are going to run with you. Is our World Food Program, our access to medication that includes healthcare, which you are already doing. And then from these two programs, you can bring in all of your programs, you can capture them in it. Now you are a nurse. Now you can be our Western director in terms of you are in charge of programs, all those local government in Lagos. If we start in Ekiti, if we start in Osun, you are the one going there with resources given to you to institute that region and make sure that the takeoff system is done like it is done in your place in Lagos. You become the regional director. So that is how we intend to go with you.
We are clapping already. Regional director.
So what I'm
That's
saying
love.
now is that from the documents you've given me about your organization, it means that everything I just said here is what you people are doing.
Yeah.
When you have these two programs running, every owner of your program can capture. During the time you gather these two people, you can do all the others, University of the Third
Yes.
all the other programs, you can do them here. And then we can organize conference with cost upping. This thing doesn't concern government for now because government cannot fund this program. You know that they can't. And you don't owe them any data. You don't give them our data. After all, it is in the software. You don't give them. Because once they see this kind of thing going on now, maybe the National Senior Citizen Center, who will not fund, but we want to use it to eat, to collect money and eat. Now that you're suffering, they won't come. We are running this as a non-governmental organization. Because we created the National Senior Citizen Center, but today the National Senior Citizen Center has not recognized NGOs in Nigeria after we suffered and created it. So, Madam, is there any question you have for me before the time goes up?
Please unmute yourself. Unmute yourself. Unmute yourself. Unmute yourself. Unmute yourself.
Okay. Madam, is there any question you have for me?
Can you hear me, sir?
Yes, ma'am, I can hear you.
Yes. Yes. I want to appreciate your organization for this kind of robust support that you are, and assignments that you are giving my organization, because the job is not for me alone, but everyone that is in the organization. Hello?
I can hear you, go ahead.
Are you here? Okay. But everyone in the organization want to appreciate you, sir. But my question is, are we going to be giving training before this program, or how do you intend?
All the tools, how to use the training, yes. You'll be given training. You'll be given training how to use the software, even physical training. Somebody will come to Lagos and train all of the volunteers. If it is 1 week, if it is 3 weeks, they'll host you people in a hotel or anywhere and train you. If it is a training that we can do online, we can do it online. We can pay, we can hire facilitators like this kind of platform, pay the host or get our own, where we can now do the live training. If it is physical training that we need to do, the trainers, the facilitators will come over to Lagos, get a venue, and we'll do the training. We'll be budgeted for that. You understand? Okay. Then how to use the software, how to use all the forms, how to fill the forms, what is expected. Even how to care for the old people. You are a nurse, you know about the blood pressure, what is supposed to be and what is not supposed to be. But a community health worker doesn't know that. So a community health worker will be trained, they will do all those, we'll have a chart of blood pressure, sugar level, the up and the low, how it should be. So that if the person forgets and takes your blood sugar and he forgets the figure, he will look at it, whether it falls within the right chat. But you have a lot of work where you are trained, then you will now train your people. You see, that train the trainer. So you have to be, that is why I will make sure that you get the concept. I'm so happy you are a nurse. So when you have the concept very well, you are trained with other people, as we are going to other communities, because you share the knowledge. As you keep going, you are sending it to different obas, and they are bringing in their people, they register them. We are not giving them generic drugs. We give them first-hand drugs from America, from Canada. If you take it, it stays in your body for about 18 hours before you start having to take another one. It's not those chalks they say in health bridge in Onitsha. So what I'm trying to tell you is that this is a program that we are going to spend a lot of money. We are spending a lot of money. And it is done in Cameroon the same way. It's done in Nigeria. So we will train you, give you all the tools, give you how to use the software. Everything will be known fixed before we start going back to the old people, to mobilize them and say those who want to be interested should register and become member, so that we can develop ID card for them, biometric ID card for them, and then that is where we take it from. But you, your volunteers, your community health workers will be put on salary because they're not going to be working for free. You yourself now will be on salary as a country, as the regional director. You will go back to start working again as a nurse, as an active woman that now you're now talking with government, public policy.
That's lovely.
We start teaching you how to approach government, how to advocate for the rights of other people. You take this data to local government and try to attract them to also make input, because this is their responsibility. So the country director will be there,
yes,
representative will be there to help you. We, the head office in Texas, will also be there. The international office here in Canada.
Thank you, sir.
So this is a progress. I just gave you a concept. You go to our website, you read all our programs, you read what we have, who we are, and where we are. I've dropped our website there, and then you take it up from there. You can even register to become a member, because that is where we start, so that you also have a voice. You have a power to vote. It doesn't take you anything.
That's lovely.
Then
that's lovely.
When we set on ground, we agree on all terms. We start with our partnership. So for now, without which we've stayed so much, I didn't plan to stay so much, but it's good that I've been able to get enough information, and I've been able to sell out much to you, so that you now know that what you're doing can be scaled up, can be standardized to international best practice, that WHO will call you to come and do presentation on what you are doing at that level. And then you become a role model for Nigeria.
That's good.
Thank you, sir.
And that's what we want.
I'm grateful, sir.
Well, Adi Junction, thank you so much.
When you go to our website, you can drop our email. We have my phone numbers, everything's are there. We can follow up with discussion. You discuss it with your directors, the new dimension that finally it's no longer going to be you alone. It's now something that you will still be doing that thing which you have passion for, doing it to the end of your own life, until when you say you can no longer do it again. And you will be paid for. You've been paid better off than when you were paid in the local government. And you enjoy your job because you are still a young woman. You are not old.
That's it. Thank you so much, Ambassador George. Andres, thank you so much for coming on board to at least be part of this enlightenment, encouragement, and empowerment into this MOGA Foundation, and those that have been volunteering to work with her. It's a welcoming idea. And I think Dr. Ambassador Lawa following show now will be much happier listening to you
Yes, sir.
and all this processing she has to pass through. She too has to go for university third age now to be able to attain the level you are calling her into now. So because she's already retired, she's among the old people too now. So she's able to rebrand herself and come on board and take the responsibility. That is lovely. And whenever we have to meet again, just let me know. I'll make it done like this too.
Yeah, me and her will do a follow-up. And then we'll know when to meet again.
To monitor her and to see what we can do and all the trainings. I believe God has helped all this far. Will continue to be with us. I don't know if Ambassador Andrew, please, are you with us here?
Of course. You could not be here unless I was here.
Thank you so much. Please, I want you to introduce yourself to Ambassador George, then for him to know more about AHIABGA-TV and what we do. Because he said he's in love with this system and this television.
Well, it will be helpful if you make sure you include your email address in the contact. I can give you a little bit more information there. But I'm Andrew Williams Jr. I'm here in Los Angeles, California. But I am tied to Nigeria. Last year, I was inducted as a Prince of the Easy Igbo Palace in Ghana, representing those Igbos in Ghana. And so I do look forward to connecting with us globally. But I am the founding president of what's called the Ad Hoc International Advisory Board of Goodwill Ambassadors. And the intent is for us to have a TV network so that our Zoom broadcasts like this can reach a wider audience. I've been providing this platform now for about 18 months through another organization called the EdFu Foundation and in association with the Universal Citizens Media Network. But now this year, I'm taking that responsibility on my own company, Parksy Trading Company. So the idea is that we connect together our people throughout the diaspora with not just social enterprise, but also we have to take advantage of what's the African Union calls their legacy projects for the diaspora. So I'm hoping that all Nigerians around the world can connect through us back home and that we can connect together outside the African continent. Thank you very much.
Okay, this is a good point. I'm going to get, that's what I'm trying to put my information, but I don't know why the chat, I can't drop a chat there. Why?
Everyone should be able to use it, but no problems. Just WhatsApp Ambassador James.
I want to drop our emails and everything because I so much like the stability I'm seeing here. I so much like the structure, even the Nigerian network that is always like the last general annual meetings we had a very serious system failure because of we use the open Zoom system. But with what you have here, I guess if that meeting was held in such a place, could have been so good for us to function properly because we had to cancel some of our program because there was a lot of problem of in and out, But what I'm saying right now is that this is stable, is perfect, is good, and this is exactly what could have been used. So those who cannot get to Zoom can use Facebook to see what we're doing.
Well, yes, but it's not free. That's why it's a sponsored project. And that's why we require our own logo to be included if there's any promotional material. And of course, we look forward to finding ways that we can also have our message reach out to your network. So, but James Opatuwi is our contact, and anything you want done, we can get it done.
Oh, okay. Then we that's why I'm trying to put my emails.
Well, the chat should be open to everyone, so it might be your device.
I don't know. I'm trying to do that, but it's not working.
Yeah, just come down to me. I will get it.
Okay, I should drop it. I should get it to you.
Yes, but everyone should be able to use the chat. Okay. It might be your device. I don't know, but I've never had that problem with anyone.
I try to use it, but it didn't work, but it's okay. I'm going to get it to him and we'll take it off from there.
Excellent.
Yeah.
Also, for your calendar of events for 2022, we would be interested in knowing in advance what you have so we can include that in our calendar and vice versa.
Okay,
Thank you, Pastor Jay.
that's good. Thank you.
Thank you. Thank you so much.
Wow,
So,
that's a
Ambassador
good
Georgia,
one. This is a good discovery. I'm so happy. It's good. Look at how James in Nigeria is just having a steady. Look at how you're smiling. You are just so confident where you are. Unlike what we had last week, where people had problem with their network here and there, and it was a big problem. Is Dr. Rotumi still there?
I've been all year and been seeing you educating, talking, and everybody laughing, helping us. Wow, this is the longest, even with the United Nations, the one we had.
I know.
It was the longest meeting I could. Everybody's feeling at home, you know. Is awesome, and I keep telling Mrs. Folorusho that she should just keep doing what she does. That one day she will be recognized. She was even this morning we she talk, and I told that woman, just leave it, don't worry, because what I know is that if you do the right thing, you will be seen. And if what you're doing is not centered on you and you want something that will live after you, don't worry, someone will come and help you to restructure. And I'm so happy that the organization like yours has come in. And when she told me that I must join and all that, though I was a bit tired because there's, Lagos crazy traffic and someone just came, hit me and trying to find trouble, go home. I was just saying, what the happening in this country? We won't change our mentality. But I also am a very hard advocate of the elderly. It's been a long time I've been advocating, and she also joined me in the cause until the federal government came up with their own. But I just see that what the federal government is doing is just for the people. Let's just give them. That is what I'm saying, because the right thing is not in place, and the right protocol, they're just giving the people that are handling in, cannot give the young people to be handling this kind of thing for the elderly. You give them, you let them organize their own thing, then let the young there learn so that they can pass the baton to them. I want to say a very big thank you, and I'm interested in the first let me say the first Zoom that we are meeting. I'll be that everybody, everything is stable. It's like we are getting closer to heaven, and the sky is getting clearer and clearer, and we are asking, where are we? This is a wonderful thing. So I'll be interested in this because of so many things I handle, and also the university I also work with. Let me turn on my video. Maybe you can see me.
Yeah.
Yeah, let me turn on the video. Just hope you guys can see me now.
Yes, I can see you now.
All right. So I've been advocate to the extent that the police are making the stakeholder in what we call the poker cuff, which is police against courtesan and other vices. In fact, we're just discussing on how we find out that in Lagos alone, the populations of Lagos, 65% of that population is the youth.
Of course.
So it's through the
Nigeria has a very useful population.
Yes, it's true, especially Lagos. It's through the NSAS that they discovered that, and most of the vices is coming from the youth. So, and they don't have good image with the youth. So that's why they came up with the poker cuff. Notwithstanding, want to applaud you so much with the elderly. I've moved around. I've gone to Liberia. I've gone around. I know that Finland has the best program for the elderly. And even the United States is number 7 in the track.
Canada is, I think, second. Japan
Yes,
second. Yeah.
yes, Canada too. Then Netherlands.
Mhm.
So, and I'm happy that if the small giants can be, pulled up by the bigger giants, I'm talking of your organization, we will be able to set a standard that other will follow. We have so many other organizations in Nigeria that say elderly. I've been able to go to all, but I have stayed with Madam Folorunsho in that no matter what decision she wants to make, she bring it to my table and ask for my input. If I didn't see anything, she will not go ahead. So it's more or less that, doctor, we have to do this together. Most of the program, she's always making sure that I'm there sharing the occasion. So I'm very happy, and I will not stop supporting her. And also, your organization, I want to say a very big thank you. And then she has been very, very honest in the disbursement of the donations everywhere. In fact, is this about donation that has been as a fair that won't she be choked up one time? I said, no, that don't worry. At the right time, things will work. And I want to say a very big thank you. And I would love to know more about your program. And
go to our website is there, www.gcvsi.org.
I will check the charts to get it out before we end it. And though I have several awards to myself, but that is not the real thing to me. But what is the real thing is leaving a legacy like she's doing and setting up a standard that others will follow, which is I've gone around, as I said, I'm even planning of going to Cotonou, Liberia, and Mali soon. And what I normally go there is to meet with all this, and I find out that the elderly too are having issues. So if MOGA can be used as a litmus test to expand to all this region, maybe the government can set up and borrow.
The truth is that social protection programs, as a public policy developer, social protection programs are capital intensive, and it's something that only countries that have a system that works, a taxable system that can sustain, where corruption is less managed, and again, where there is use of technology, because it's a program that so many people will want to fit in when they are not, they don't have the inclusion criteria to get in. So, like you see the social intervention, the constitutional money, fund transfer, the Nigerian humanitarian ministry is running without biodata. I wonder how
that is,
can you be running?
Sir, that is in fact that was one of my fights that when they inducted me into one of these Institute of System and Information Technology and all those ones. And these are the institute that is working closely with the federal government. And I asked them that, are you not talking to, I've been in China, that's why I did my second degree with the master's. And I also have one in US. So, and I asked a question. I said, how can government work when you have data scattered everywhere? The federal, the road safety has their own data, the bank has their own state data, this one has their own data scattered, biometrics scattered everywhere. And I asked them, what are you doing to unify this or have a data bank or a data farm to make sure that if anybody require information, this data bank will be the center to provide information and people can work based on these data. And that is why when the federal government is now coming that they'll be giving the elderly the ID card and say, oh my
Which
God.
ID card? That's madness. The truth is that the federal government is being, you don't run social protection program from the federal government. The state government,
Exactly.
the state government should run their social protection program according to their strength. You don't run that. You can, okay.
You pass
just
it,
like,
even you start from the local government.
That's
Where
what I'm
they say,
saying.
because they are, that is where the issue.
problem.
Then
Look
you
at the
grow to
problem
the
of-
state, then to the federal.
Look at the problem of maternal and child mortality. It's not going to be any different from
No,
pregnant
don't go
women
there.
dying
Don't go
from
there.
under 5
That's-
children. It's the same thing. Primary Healthcare Development Agency is the same agency like Senior Citizen Center. They are just making noise. You know,
They're just making noise.
they want to go to the news, make as if
Let me tell you, I was called upon to the one of the, I don't want to really go into that because of the committee for the health in one of these House of Assembly. You can't believe that after giving them the insight and what I saw in India, that I know it will work if they will go through this and other. You can't believe that the chairman of the DC, call himself honorable, called me that it's not everything you say in public. You understand? Bring this thing, let us see how we can work. I say, it's for the public. That's why I brought this idea. And before I know it, this honorable is having one big private hospital and is running. I don't know how he went to India or wherever he got those solutions, and he's running it there, sincerely. And then I said, oh my God, then how can I? And that is one of the things if there's a way, you understand, we can write on the wall for the listening governments, even if they are deaf and dumb, they can still see someone who can help them to interpret what is there and then begin to care. I care for the elderly because I know that I'm already getting to that stage.
It can only be when we do this kind of collaboration we are doing. If we are able to make this thing work and we are able to capture, for instance, say Lagos State, we have 30,000 older persons under our care and we're able to prove it with a simple system, then the federal government will embarrass.
You know what? Let me come there. Let me come there. She knows my pool too, because most of these local government chairmen too are my friends. So it's just for me to meet with them and see how make it that, see, you guys can run these things. Give it to us. Let us help you to run it. But we will make sure that everything that has been done, you guys are carried along with it, because that's exactly what the state government governors tell us about the poker cup I told you about, that you guys go and run these things and help us to get these children out of the streets, the youth. But whatever you guys want to do, give us the budget or put it on our table, we will make sure that I run it. But it's okay, fine. But now we're on our table, try to make sure that we run something that is not with the government on our own, but carry the government along. So I can assure you with her that you'll be proud anyway. You'll be proud of what we'll be able to achieve.
Okay,
because what she's
thank you for people
achieving.
like you being with her. I think we're going to get this job done. We're following our policy. We have to talk from organization to organization terms, and then we take it on from there. Let's not keep Dr. Andrew continuously here. I've overstayed my time. He has tried. Mr. James, I'm so grateful for this union. If we can continue like this, even to organize organizations to come together and share their experiences and see how they can find common grounds to work together, it's also going to be a good start to move forward.
It's a fantastic one. Okay, sorry, sir. Can I say something before this thing? You know, I'm also they make me the ambassador for the senior citizen. There's a senior citizen association of Nigeria, which is a very distant. These are elderly. There are many in number. These are civil servants that they are former permanent secretary or whatever that they came and formed that too. So if you don't mind, maybe after the MOGA with this thing, if you want to extend a hand to them, well, I don't know. If it's part of
that's why we have to get our contacts and then come on board together and start talking, start engaging each other.
Okay, when you're ready, let me know. Because day before yesterday, we went there to do our own to the elderly. I have the pictures. We went to give them this Christmas gift and all that, and the elderly were very happy because they have larger number, and they come there to do exercise. They have a center given to them by 5x1 that runs this internet facility. Is an elderly might give them that building that they are using as their center, which they use, and we've done several programs with them. So most of that, the first program I did with them, and so I spoke with them, that is when they make me that I'm the ambassador to the elder, that an advocate for them. So if that is okay, I'll talk with them so they can also join the team. So with that, because they too also are already talking with the federal government.
Yeah, but and again, I want to tell you that we are also with the NHIS. We have a community. We are a community. We are an HMO under Community Social Health Insurance Program. So we had under the National Health Insurance Scheme. It is on the umbrella of the National Health Insurance Scheme that we are going to establish this program with Madam. So it's a kind of insurance for those old people, where they now have healthcare in their community within their reach. You can imagine somebody who is on hypertensive drugs that each month he has to spend about 2,000 something to buy, or 1,005. And now that person is on the whole year, the person will be receiving this drug just like that, maybe on a token, you know. So that's it.
Well, if I may be so bold, I myself am in America. I've never been yet to Africa, but I've been paying attention to Africa since 1968. And in 1999, I was very much aware when Kofi Annan launched the United Nations Global Compact in 1999 as General Secretary. It was in 2000 when he entered into what we now know as the Millennium Development Goals. This is the second phase. The Sustainable Development Goal is only the second phase. But what Kofi Annan also did was set up the United Nations Global Compact. And they have an Africa strategy that's now headed up by an African from Kenya. Her name is Sanda Ojiambo. They have a 2021 through 2023 global strategy specifically for Africa. I recommend that we look beyond the governments of Africa itself and work with civil society and people on the ground to collaborate with these international organizations to take advantage of the framework already in place. But I do look forward to providing a way for us to all connect together. I look forward to providing maybe this platform every week for the next year if we are going to move together to get things done. James can connect us together. Thank you.
Yeah, I've gotten the link already, and I've put it on my browser. I'm going to check all these links up there to see how I can respond to them each and one. Yeah. So I think you're doing a good job. I like your TV, and I told you I'm going to take it up from there moving forward, and we're going to see how it works for us. Thank you, Mr. James, for this union that you created. Thank you, Mr. Remy, Dr. Remy Olotimo.
Thank you.
Thank all of us that participated today. Dr. Andrew, for your the platform. Thank everyone, Mrs. Lawa, for all she has been doing. I feel that we can move forward. I've been in Africa. I've worked in the bush. If you need to see my videos and my pictures, you're going to know that I got first-hand information. I have real-life information about the situation in Africa, and I stand in a better position to give public policy direction and policy direction on that. So, being a member of the open-ended working group on aging at the UN, under the UN General Assembly, and working as a special consultative status on the United Nations, we also make inputs, nominative elements, and things like that in policy development that are used for regional development too. So I feel that we're working together and moving forward. We're going to do much, and that's what I can say for them. Thank you.
Okay, thank you, everyone. I'm going to end this
Thank you,
session.
James. Thank you, James. Thank you. Thank you, Dr. Remy. We follow up from our contacts and Madam Lawa, thank you. You are the moment. You're the champion of the moment. Thank you so much for your initiative. And thanks to everybody. As I say, good night, happy Christmas, Merry Christmas, and prosperous New Year.
Christmas.
Thank you.
Okay, Pastor James, you want to close us out? You open us up. So do you want to close us out?
You say what?
I was asking Pastor James if you wanted to close us out since he opened us up.
Yeah.
Ambassador George has already done that. He has even
Mr. James, I'll need to get a record of it, the link to the recording later.
It's already forwarded. No worry, it'll be shared.
It's in the chat.
Ambassador Andrew has already. Yes,
it's in the chat. Yeah.
Yes. Once we get to the chat, I'll still share that with you.
Yes.
Ambassador Andrew can share it. If you share it to my WhatsApp, I'll share with you. So thank you, everyone. Officially, we are rounding up this and closing up. Thank you, Ambassador Andrew, for this platform. Thank you, Ambassador George, for coming on board to at least support us on this and educating us. Thank you, Ambassador Lawa, for all you've been doing. You are the woman of the moment. You brought us together. So thank you so much. We appreciate everyone. Dr. Lurem, even for you staying to this moment. I know that has gone, so we appreciate you. Thank you so much. Much respect. Right. We are still going to get to know ourselves better. I shouted you up sometimes.
Okay, fantastic.
Yeah.
Okay, fantastic.
Thank you so much. Fantastic. Everybody, I say thank you. Ambassador Andrew, thank you.
Yeah.
God bless you, sir.
All right, we're going to wind it up.
Yeah.
Thank you so much.
You.